here is your stem.
Ma'am. Or 22 year already with history. Yes, sir. So you will ask what going on. Some questions considering the surgery. Yes, ma'am.
Okay, so if you've read and understood considering its surgical pathology station, please tell me what would be your provisional diagnosis or the
Ma'am, my
differential
professional diagnosis.
Yes.
Provisional diagnosis is ulcerative colitis, and the differentials which include are Crohn disease, carcinoma of colon, any inflammatory or hematomatous polyp,
Yes.
and irritable bowel syndrome as well.
Okay, how would you confirm your diagnosis? One colonoscopy they've already done,
Yes,
and it shows little less than a centimeter
less than 1
lesion. Yes. What more
Along
can be
with that,
done?
colonoscopy along with biopsy. This is the first
Yes.
test to confirm the diagnosis. Other
Okay.
than we can do is fecal occult blood or fecal
Right.
calprotectic
Right. Right.
and a full blood count to see is there any macrocytic anemia or something.
Yes.
And if we are suspecting any tumor, then we will need to do some staging for that. We can do CT scan or to stage the disease if we are suspecting any tumor inside.
Okay. Here, one terminology, surveillance colonoscopy, has been used. So,
Yes, ma'am.
if I want you to explain that, what do you mean by this, and at what
Uh,
stage one should start surveillance colonoscopy? At what age, and what is it?
Madam, the surveillance colonoscopy actually we use to find out is there any pathological lesion is there, or it is to find out the progression of the disease. In case of ulcerative colitis, it is started at around 21 years of the age. But in case of if we are suspecting any genetic diseases like hereditary polyposis coli and any other pathology, then it will start at around 15 years of the age.
Okay, can you define ulcerative colitis? What do you mean by that?
Uh, Ulcerative colitis is a chronic inflammatory disease
Yes.
characterized by inflammatory process involving the mucosa, and it nearly always involves the rectum.
Okay. Please tell me what treatment can you suggest for this patient?
For this patient,
Yes.
initially we do a lifestyle modification, like dietary modification, in which we do low residue diet. Along with that, the medical managements are steroids. Along with that, immunosuppressive drugs. If steroids and immunosuppressive drugs such as methotrexate and aminocyclines will not work, then we will move to biological drugs. These are uh, monoclonal antibodies such as infliximab and adalimumab.
A patient?
And after that,
Yes.
if all this medical management fails, then we move towards the surgical management that will include pan-protocolectomy with and ileostomy.
Right. Okay. Please tell me, right, what are the risk factors for the colon carcinoma that you should keep in your mind?
Uh, in case of ulcerative colitis, the risk factors are if there is any excessive bleeding that is not controlled, or is there any like weight loss or altered bowel habits and constipation, diarrhea mixed with constipation. So these are the risk factors that may point out that maybe there is or weight loss, anorexia. These are the factors that may point out that there is a chance of carcinoma developing inside this patient.
And hereditary. Which genes are associated with colon carcinoma, especially when it
Uh,
comes to ulcerative colitis?
there are three genes basically. One is APC gene, which is a tumor suppressor gene, which causes hyperplasia. The next is KRAS gene, which is a proto-onco gene. It will cause dysplasia. And the third one is P53 gene, which is also a tumor suppressor gene. It will cause adenocarcinoma.
All right. Okay. Please tell me how these proto-oncogenes and tumor suppressor genes act.
Uh, Mechanism of their genes are
Yes.
different. For example, if we talk about proto-oncogene, which is KRAS gene, it encodes a protein which is called KRAS, and it forms a signaling pathway KRAS slash MAPK pathway, which transmits a signal from outside of the cell to the nucleus, and it is actually a GTPase protein which turn off and on the specific gene, and it is responsible for the uncontrolled proliferation of the cells. And the two other tumor suppressor genes are APC gene and the P53 gene. APC gene basically actually negatively regulates the WNT pathway, and it causes and forms the complex that causes the degradation of the beta catenin. And otherwise, P53 gene, it is basically a tumor suppressor gene. It has three main functions, like
Okay.
it stops growth cycle, repair
Right.
DNA, and it
Yes.
apoptosis.
Okay. Right. When you have to consider adenocarcinoma, so what are the different types of adenomas that you can recall?
Tubular, villus, tubular, or tubulovillus.
Okay. How about, okay, non-neoplastic and neoplastic? How would you divide them? How would you classify them? Do you have any?
Okay,
Non-neoplastic
madam.
would be, yes.
Non-neoplastic would be inflammatory
Okay.
and
Or
and
hamartomatous.
hyperplastic,
Okay.
and hematomatous. I think these three
Hamartomatous
are.
and metaplastic, and then neoplastic, or the ones are villus, tubulovillus, and tubular. So out of
Yes.
all these, which one has the highest chances of causing malignancy? Villus.
Hmm. Tubular,
No,
villus. Sorry,
villus.
villus.
Villus, yes.
Villus.
So the malignant potential of adenomas depends on which factors? Can you name few?
If they have underlying APC mutation, which is
No,
located on the
it's type of adenoma, diameter of adenoma, like less than 1
dynamo and
centimeter.
size.
Yes, size, and then
Size.
degree of dysplasia. Basic,
Okay.
basic. All right,
Mm.
please help me and read the lesion, the image which is in front of you.
Uh, this is a colonoscopic picture which showing
Okay,
that the red color is showing some kind of hemorrhage or bleed,
all right, and
and along with that there is uh, it seems like it is a ulcerative colitis picture which shows contact bleed. Along with that, there is a inflammatory pseudopolyps formation.
can you define the term ulcer for me, please?
Ulcer is a break in the normal epithelial layer of any tissue. It could be
Okay,
skin or it could be underlying mucosa.
right. All right, please. Okay. Right. But I want you to tell me the pathophysiology of ulcerative colitis.
Uh,
Etiology.
yes, ma'am. The pathological factors are idiopathic,
Yes.
immunological,
Yes.
environmental, and genetic. And
Yes.
in pathophysiology, this leads to formation of the tumor necrosis factor alpha and other cytokine mediators which act on the epithelial cells and cause the loosening of them and reduce the tight junction among them, and which allows the bacteria to move inside the wall of the gut and cause activation of the innate and immune response and cause the inflammation.
Okay, good. Right. For carcinoma,
Yes, ma'am.
right. Which classification system? If you could tell me both,
Yes,
Duke's
ma'am. Ma'am, there are two
classification and
classification
TNM.
system and
Yes, please.
Dukes. Jukes and TNM classification system. Jukes is further divided into A, B, C, D. In A, there is the involvement of mucosa and submucosa. B is divided into B1 and B2. In B1, there is involvement of the muscularis propria, and in B2, there is extension beyond the muscularis propria. C is further divided into C1 and C2. C1 involvement of the lymph. C is basically involvement of the lymph node, and C1 is 1 to 3 lymph node involvement, and C2 is more than 4 lymph node involvement, and D is a distant metastasis.
Yes, and TNM, quickly.
The next staging is TNM staging. T is involvement of the mucosa submucosa. T1 is involvement of mucosa submucosa. T2 is involvement of the muscularis propria. T3 is involvement of the serosa, and T4 is further divided into 4A and 4B. 4A is beyond serosa, and 4B is involvement in adjacent structures such
Yes.
as prostate, uterus, and other things. Same like N,
Distance.
N0, no lymph node involvement, N1, 1 to 3 lymph node involvement,
Good.
M2, more than 4 lymph node,
Okay, good.
and
Thank you.
M0, no metastasis, M1, when there is organ metastasis.
Thank you.